Lack of this vitamin is causing your bladder issues. Do you frequently wake up during the night to use the restroom? Maybe you experience leaks or that persistent urge to urinate, making daily life uncomfortable. If so, you're not alone. Millions of people grapple with bladder issues, often not knowing that a simple solution could lie in correcting a vitamin deficiency. One crucial vitamin that many overlook is vitamin D. Yes, this sunshine vitamin plays a pivotal role in maintaining bladder health. In this video, we'll explore how a lack of vitamin D might be the hidden cause of your bladder problems and how boosting your levels can make a remarkable difference. Before diving into the connection between vitamin D and bladder health, let's understand how your bladder functions. The bladder is a muscular sac that stores urine until you're ready to release it. Receptors in the bladder wall act like pressure sensors, sending signals to your brain when it's time to go. When you urinate, your brain instructs the bladder muscles to contract while relaxing the sphincter muscles, allowing urine to flow out smoothly. But what happens when this finely tuned system doesn't work properly? Issues such as frequent urination, leaks, and urgency can arise, often linked to an underlying problem, vitamin D deficiency. Vitamin D isn't just essential for strong bones, it's vital for bladder function. Receptors for vitamin D are found in the detrusor muscle, the muscle responsible for contracting and emptying your bladder. When your vitamin D levels are low, these receptors can't function effectively, leading to a host of bladder-related issues. Let's explore how vitamin D deficiency impacts bladder health. 1. Increased risk of urinary tract infections, UTIs. One of the most common bladder-related problems linked to low vitamin D levels is urinary tract infections, UTIs. Vitamin D strengthens your immune system, enabling it to fight off harmful bacteria effectively. When vitamin D levels are insufficient, your body's antimicrobial defenses weaken, allowing bacteria to invade your urinary tract. Studies have highlighted the connection between low vitamin D levels and UTIs. For instance, women with vitamin D deficiency are 3 times more likely to develop UTIs. Another study revealed that adults with adequate vitamin D levels had a 39% reduced risk of UTIs compared to those who were deficient. This demonstrates that maintaining healthy vitamin D levels is a powerful way to prevent these infections. 2. Lower urinary tract symptoms, LUTs, and overactive bladder. If you frequently feel an urgent need to urinate or wake up multiple times at night to use the restroom, you might be experiencing lower urinary tract symptoms, LUTs, or overactive bladder. These conditions can severely impact your quality of life. Low vitamin D levels can contribute to LUTs and overactive bladder by impairing the function of the detrusor muscle. This leads to inflammation, bladder muscle dysfunction, and difficulty controlling urination. Research has shown that vitamin D deficiency is more common in children with bedwetting issues and adults with overactive bladder symptoms. Even men over 50 with enlarged prostates, a common cause of urinary problems, often have low vitamin D levels. 3. Potential link to bladder cancer. Vitamin D's role in regulating cell growth and development extends to your bladder. Low levels of this vitamin might increase the risk of abnormal cell growth, potentially leading to bladder cancer. A comprehensive analysis involving over 62,000 participants found a possible connection between low vitamin D levels and a higher risk of bladder cancer. While this doesn't confirm causation, it underscores the importance of maintaining adequate vitamin D levels for overall bladder health. Now that we've discussed the problems caused by vitamin D deficiency, let's look at how this vitamin supports your bladder. 1. Boosts immune defense against UTIs. Vitamin D enhances your immune system by regulating the production of antimicrobial peptides like cathelicidin. These natural antibiotics patrol your urinary tract, fighting off harmful bacteria that can cause UTIs. By maintaining sufficient vitamin D levels, you can reduce your risk of these infections. 2. Strengthens the bladder lining. A healthy bladder lining acts as a barrier against leaks and infections. Vitamin D helps your body produce proteins that strengthen the connections between cells in the bladder wall. This tighter barrier reduces the likelihood of urine leakage and bacterial invasion. In fact, studies have shown that vitamin D supplementation significantly improves bladder function in older adults with overactive bladder symptoms. 3. Supports bladder muscle function. Your bladder muscles contain vitamin D receptors that play a crucial role in proper muscle contraction and relaxation. Adequate vitamin D levels ensure these receptors function optimally, reducing the frequency and urgency of urination. 4. Improves nerve function. Healthy nerves are essential for bladder control and sensation. The nervous system also has vitamin D receptors, including those that regulate bladder function. By ensuring you have enough vitamin D, you're supporting the nerves that help your brain communicate effectively with your bladder muscles. How do you know if you might be deficient in vitamin D? Look for these common signs. Frequent infections, hair loss, bone and back pain, fatigue, slow wound healing, feelings of anxiety or depression, muscle pain. If you suspect a deficiency, a simple blood test can confirm your vitamin D levels. Certain factors may increase your risk, such as living in areas with limited sunlight, having darker skin tones, or spending most of your time indoors. The good news is that increasing your vitamin D levels is relatively simple. Here's how. 1. Sunlight exposure. Aim for 10 to 15 minutes of midday sun exposure most days, depending on your skin tone and location. Be mindful of the risk of sunburn and use sunscreen after your initial exposure. 2. Dietary sources. Incorporate vitamin D-rich foods into your diet, such as fatty fish, salmon, mackerel, beef liver, egg yolks, and fortified foods like milk and cereals. 3. Supplements. Talk to your doctor about taking a vitamin D2 or D3 supplement. A typical recommendation is 800 to 1000 IU of vitamin D3 daily, but your doctor can tailor the dosage to your specific needs. Additional tips for a healthy bladder. In addition to maintaining optimal vitamin D levels, adopt these everyday habits to support bladder health. 1. Stay hydrated. Drink plenty of water to dilute your urine and flush out bacteria. 2. Limit irritants. Avoid excessive caffeine, fizzy drinks, alcohol, and spicy foods, as they can irritate your bladder. 3. Consider cranberries. Cranberries or D-mannose may help prevent UTIs. Discuss these options with your doctor. 4. Practice Kegel exercises. Strengthen the muscles supporting your bladder with regular pelvic floor exercises. 5. Maintain a healthy weight. Extra weight can put pressure on your bladder, leading to leaks. 6. Don't hold it. Use the restroom when needed to prevent undue pressure on your bladder. 7. Prevent constipation. Regular bowel movements can reduce bladder pressure caused by constipation. 8. Quit smoking. Smoking can worsen bladder issues, so quitting can significantly improve your health. 9. Relax with a warm bath. A warm bath can help soothe tense bladder muscles. In conclusion, bladder issues can be disruptive, but understanding the role of vitamin D offers a simple yet powerful way to improve your bladder health. By addressing a vitamin D deficiency, you can enhance bladder muscle function, reduce infections, and support overall urinary health. So, don't let bladder problems hold you back. Take charge of your health today by boosting your vitamin D levels and adopting bladder-friendly habits. If you found this information helpful, don't forget to like this video and subscribe to our channel for more health tips. Together, let's work towards a healthier you.